Hello, I'm Binoy Matthew, physio based in London. Recently, I've been asked by a group of physios who are doing the master's program from Leuven La Nouvelle University from Belgium to give my opinion on some trends and my reflection on athletic groin pain. So, this is an area which I've been involved in the last 10 years and I teach extensively and also work with these patients on most days of the week. So it's looking into sort of I've split that into sort of three categories here. So let's go one by one. The first one is looking into what are the things that I'm convinced regarding the management of athletic groin pain, which I feel has not been proven in the scientific literature. Number one has to be the value of sport-specific training. So we know that incorporating sport-specific exercise in the rehabilitation can help patients improve their strength, endurance, and functional capacity. So, and we're going to rehab them quite differently, especially in the end phase on various sports. So, so that's something which is quite an important. For example, you might emphasize more the adductor element in football, whereas if you're dealing with more a dance-based population, you may be focusing on the hip flexors and other areas. So while sport-specific training can be extremely useful, in my opinion, there is very limited research on effectiveness for the athletic groin pain. So that's definitely one area where I feel I do quite a bit, but the evidence is not too strong. The second element is the importance of addressing psychosocial factors. Many patients with chronic athletic groin pain have underlying psychological factors which can impair the rehabilitation, such as fear of re-injury, anxiety, stress, and ability to be working at the same level, pre-injury levels. So we know from the research from ACL that those factors are highly predictive of return to play and also future injuries as well. So addressing these factors early through education, counseling, stress reduction techniques, all these are really important for getting an optimal outcome in this patient group. But again, we have very limited research on the effectiveness of this intervention for athletic groin pain. Another one which we need more evidence is the importance of a graded return to sport. So gradually reintroducing patients to their sport or activity is crucial for the successful return to sport. In my experience, a graded return to sport involves a stepwise progression of activity, starting with low intensity, low impact, and then building it up into more end-stage plyometric sport-specific drills and all that. So again, there's a little bit of research there, but we need further research to sort of give us the optimal timing and progression of this sort of approach for athletic groin pain. So the next question was looking into what are the important things that I've learned or discovered in the management of athletic groin pain in the last 5 years. So there's quite a few things. So I'm just focusing on some of the core ones, which was a bit of a surprise even for me because I'm quite more rehab based. But for me, the number one tool for sort of optimal recovery is patient education. So educating patients about the condition, the treatment options, the shared decision making, importance of self-care, self-monitoring can be very helpful in promoting patient engagement and adherence. So patient's engagement is so important. So I think getting that education right is an important element. So the second element is importance of load management. So this is an important area, is especially when you're dealing with repetitive overuse injuries. So managing that sort of training load, having a system to look at both the internal and external load. So it's just not the time on the pitch, but also the non-sport training, the number of steps they take, looking at the internal perception of the effort. All those things are really important to sort of able to sort of get a true picture of their total load. Not only that, but also looking into ongoing monitoring, looking at the volume, intensity, and frequency of training sessions. Individualized response. So we know that patients' response to rehab will be different based on the injury history, their age, and we also know there's some key gender differences as well, which I will highlight in the next slides. So having that individualized treatment approach is really important. Finally, these patients are complex and they need a full multidisciplinary approach. So working with our medical and surgical colleagues, sports doc, working with the radiology team on imaging, and also with the SNC colleagues as well. So it needs that MDT approach, which is best for our patients. So those are sort of some of the key approaches which have sort of influenced and which I try to incorporate in the management of patients with athletic groin pain. The final question was, what do you think is the role of research in athletic groin pain, which I would ideally want to see in the next few years? Number one, without any shadow of doubt, is we need more research in the female athletic population. Most of the research has been based on young men who sort of mainly do football. We know that there is differences in injury rates as well as an anatomy in female. So, and there is an increased participation in female in various sports. So we definitely need more gender-specific recommendation, which will influence and also guide us on our rehabilitation. Second thing is looking at prevention risk factors specific for each sports. So now we know that early detection can be quite useful, and that could sort of help us to manage these conditions more effectively. So we know that some of the morphology, like the CAM morphology, can start as young as 10 or 12. So if you can pick up this sort of condition and manage these loads quite early, and also sort of prevent it from getting deteriorated in the future, that will be better in outcomes for our patient group. Finally is return to sport criteria. So when you look into other areas in sports medicine like hamstrings, ACL, we have a bit more robust criteria, whereas with the groin pain population, we need more clear research on looking at the role of clinical tests, biomechanical assessment, imaging techniques in determining readiness to return to sport, as well as identifying predictors of long-term outcomes as well. So that is something, an area which we need further research. Overall, a multidisciplinary approach is a better way of looking at this patient group as well. Finally, hope that was useful, and if you're interested in learning more, we got access to the hip and knee pain, which was released last year with more than 40 international authors, and I'm also involved in two-day hip and groin course, and I'm coming to Belgium in May. We also have a London course in June, and also in the Middle East and Dubai in September as well. So those are my links. Hope that was useful, and hope to see some of you on my face-to-face courses in the future. Thank you for listening.